room. Thank you very much, Carlos. It is a pleasure to be here with you today. We are going to start with the learned lessons in the subregions of the Americas. We have distinguished guests, Dr. María del Carmen Calle Dávila, Executive Secretary from the Andean Health Agency, Dr. Alejandro Solís, Executive Secretary of Council of Ministers of Health of Central America, COMISCA, Dr.JoySt.John, Executive Director from the Caribbean Public Health Agency, CARPHA, and the Ministry of Health of Ecuador, Juan Cevallos López. Be very welcome. In this panel, we have health leaders from different countries and from the regional integration mechanisms. And this is really important because at the beginning of the pandemic, we had a time where the countries closed their borders. They had difficulties in order to have access to global markets for supplies and equipment. However, the integration processes have been building up larger dimensions on health and integration. That is what we are going to talk about now, to understand about the lessons learned on integration processes in health and how we have the challenge now to answer in a multilateral fashion to this type of crisis. We will start now with a round table. And my first question for all the panelists, and starting with Dr. María del Carmen Dávila. From your perspective, what do you think about the lessons learned? What happened with this integration during the pandemic? And which is the potential of these mechanisms? Dr. María del Carmen Dávila is a pediatrician, a physician. She has a PhD in government and public health, and she has been a regional advisor for adolescent health for the PAHO in Washington, and she is currently the executive secretary of the Andean Organism in Health. María del Carmen Dávila, you have 5 minutes for your first intervention. Thank you very much. Thank you for giving me this opportunity. I would like to thank the organizers, the possibility that I have to share with you my experience. The Andean Health Agency has 6 countries: Bolivia, Chile, Peru, Venezuela, Colombia, and Ecuador. And we have worked closely due to the pandemic. Among the first 20 countries with more cases, we have 3 countries of our organization. And if we then analyze those countries with the higher mortality rate, we have 5 of our countries. I would like to talk about the lessons learned. Among them, we have 5 dimensions: the structural one, the health system, critical epidemiology, communication, participation, clinic, and therapeutic or treatment. We have learned that health has to do with social justice, so we have to create policies to respond to that. There are inequities, and we must treat them. We face a zoonotic disease resultant of the human mistreat to the ecosystem. We must reconstruct this and we must fight climate change. Pandemic affects all the society. We must strengthen all the protection systems, all the universal and social protection systems. And to control the pandemic and the economic reopening require leadership and effective governance and dynamics from part of the government. We must remember that governance means transparency, equity, participation, and well being in the health system. We are not meeting our goals. We do not have the best level of health possible. We must have universal systems, inclusive systems, resilient systems that take care of all of the population. True changes towards something universal cannot be conditioned because of resources. We must define the protection system. The pandemic made us have a better dialogue between health, development, education, social inclusion, economy, under a wide state politics. It is important to prioritize investment. We are not now in a we are now in a period of intermittent pandemic, and this has to do with the national public attention. Where we have a solid public health, we are in a better condition. How can we fight the pandemics, perform diagnosis, traceability, isolate the cases, guarantee health care? All the human resources, infrastructure, equipments, PPEs, and supplies have been insufficient for the demand. We must increase our health personnel with a technical profile and a humanistic profile, but also we must guarantee their contraction and their reimbursement. Information systems manage all these criteria. We can use this data, and many interventions have been left aside due to the COVID pandemic. Research is absolutely key. The interchanges have accelerated. We are seeking for the vaccine development, but we have also learned about participation and communication. We've had an infodemic. The strategies have been based in messages in order to promote prevention messages, but we need a greater effort. It is necessary to improve the health education strategies, because we are talking about a new normality. In clinics and therapeutics, kids and adolescents do get the disease, and we must understand this and what happens with them. That is why we need to have an approach of the course of life. At the beginning, we talked about diabetes, obesity, COPDs, hypertension, but obesity and weight are really important topics that we must deal with during this pandemic. Clinical manifestations have a very wide spectrum, but we are learning. We know exactly that there are two phases, and we need to use all the armamentarium according to the phases. And not let us not forget about sequelae, and the health systems must be prepared for them. What have we done? We've worked with the 6 countries We've held meetings with sanitary authorities talking about the challenges, how can we collaborate, how can we work together. We have had active participations in forums and in projects on public policies, and we are working together with the Congress, with the and we're going to issue some community guidelines to help in prevention. We are working on binational networks and webinars that have allowed us to hear everything about pandemic, but not only with figures, not only with disease, but also to talk about reopenings, talking about everything that has to do with socio-economic problems, work problems, mental health problems. So we have given a very comprehensive approach, and we are working together through 17 committees and 3 Andean committees, prioritizing, of course, the pandemic, but also the health in borders now that we have reopenings, and the topic about migrants and about indigenous populations of the Amazonas, for example, and talking about kids and adolescents, and talking about how to get prepared for this new normality. We need to, from the Lower Corner, we want to talk about integration. We want to advance towards the same goals, but with a new vision. Well-being and health as the axis, central axis for the whole humanity. I liked what President Duque told us in the 58th consensus of the PAHO. He said, we must get the best of us so that we can work together. And what the Pope said, you come change out of a crisis, either better or worse. That is why during this pandemic, we must think about our country, our homes, our future with one common work, regional integration, which is more needed than ever. Thank you, María del Carmen. Dr. Joy St. John, she's the executive director from the Caribbean Public Health Agency, where together with her team, she has been the leader in the public health response in the Capricorn area. She has been the joint director from the WHO. It is clear that facing this global crisis, there has not been a global response. Dr. Joy, what happened with the integration mechanisms in health? Which were the added values and which are the challenges that are still unmet or the needs that are still unmet? You have the word now.
Very much for this opportunity to be part of this panel. And I really like your question. I am not sure that I want to agree with it, though, because you speak about the absence of a global response. And from the perspective of the CARICOM region, um, for which I have responsibility, I think although we have had some missteps early on in the outbreak, even before it was declared a pandemic, and sometimes since, I think that the global authorities have been able to sort of right the wrongs and come up with some very useful mechanisms which the CARICOM region has bought into. The first thing that I would like to say is that, like most other countries, we had challenges with procuring supplies, and there was a supply chain issue. So once there was that reopening of the main producers, that eased a bit. But in terms of the global response, through PAHO and WHO, we had great support in getting those supplies. And we also had bilateral approaches, and of course, approaches from international development partners. The other challenge that we had, of course, was not having enough health professionals and, in some cases, health equipment. But from within the region of the Americas, from within the Latin Caribbean, we had great support from Cuba in terms of persons coming to support us. So, yes, that was not so much a global response. But the other thing that I would like to speak about in terms of what lessons were learned was that the CARICOM region really functioned as a collective, and there was political leadership for even the lockdowns, the way in which the heads of government coordinated the lockdown and the lifting of the restrictions, and the way that there was coordination in the mechanisms that were used. That was of great support to the CARICOM region. The fact that CARICOM Secretariat also was able to convene the sectors and have an interplay between CARPHA and the sectors at that regional level, so that there was the opportunity for coordination of policies, coordination of responses. I would also like to speak about the way in which we are approaching what we have realized is essential: the safe way to live with COVID-19. Now, yes, we are involved in procurement. We are involved in procurement of supplies, PPEs, testing equipment, and so on, and reagents. But we also have realized that we may not get everything that we need in time. And so, what we have determined is the safe way that we can live with COVID-19. Now, that sounds like something impossible, but that is the way that we have gone about this. We've also noted with great interest that even though there is a global facility in the COVAX facility for access to vaccines, that the production of vaccines will not be at the numbers that could cover the whole of the world. We're also not sure if this vaccine will give lifelong immunity, or we will have a seasonal paradigm as we have with seasonal influenza. And so CARPHA has been supporting the member states through the development of guidelines, the training on those guidelines, and also the fostering of research to ensure that we have the best way to return to normal life. That is work, school, and play. So the guidelines speak to how we can live safely with COVID-19. Now, it's not going to be perfect. Humans cannot stay cooped up or restricted, and we will have issues. But we will also give persons the best ways in which they can live safely with COVID-19. Now, you know that the CARICOM region is one of the most tourism dependent regions. We depend mainly on tourism for our livelihood. And so that means, even though for most of us, because there are countries that are struggling, there are countries that have community transmission, but quite a few of the CARICOM countries have not had large cases or overwhelming of the health services. So we realize that opening up our borders to tourism will mean that we will have constant opportunities for injects of new cases of disease on our shores. And so we have been working with the airline industries, with the cruise industries. And finally, we're getting some light at the end of the tunnel because our premise has been that there should be testing of both passengers on any of the conveyances and the crew, so that persons who are coming to our shores, we know that they are COVID free. And so we have been working on that paradigm to try to reduce the injects of new disease. And if there are, having vigilance at the borders and in the health services and in collaboration with other border agencies such as customs, immigration, and so on, so that if there is importation, that there will be early detection and contact tracing and control. So what the CARICOM region has done is to apply both the public health measures and the non-public health measures, commonly called the lockdown, to try to control what issues with disease there are. Now, going back to this issue of living with COVID and the sectoral approach to safe living with COVID, CARPHA has a tourism and health program. And one of the things that we have learned during COVID, I keep saying that as bad as the COVID-19 epidemic is, that there's always a silver lining. So one of the things that we have learned with the tourism and health program is that although we already had linkages to the Caribbean Tourism Organization and the Caribbean Hotel and Tourism Association, the public sector and the private sector, that because of COVID-19, the linkages with the tourism sector at the regional level and also at the national level have strengthened. And there was the development of a task force, and the strengthening also includes the standards for the hotel sector, the development of a safer, healthier tourism award, so that the traveler has the security of knowing that they're coming to a facility which has certain standards in place. And when I say a standard, I'm talking about a regional standard through a political process and buy-in by the countries as well. So we have learned that even though COVID is terrible in terms of disease, and even though we have a very high NCD burden and therefore, unfortunately, among our deaths, although there are relatively few, we are seeing younger persons dying because they had underlying premorbid conditions of NCDs. We have learned that this has allowed non-traditional sectors, health and tourism, to work much better together to put certain standards in place. Now, I go back to this whole thing about the global paradigm. The ability to have a seat at the table so that our tiny subregion of CARICOM can have a voice at the decision-making table is also something that I think blows this whole idea of not having a global response out of the window or out of the door. Because the CARICOM region has the Prime Minister in the quasi-cabinet with responsibility for health, the Honorable Timothy Harris, on the Accelerator Act board, which looks at both treatments and vaccines through the COVAX is a subset of this. And I think this is a good opportunity because normally our region, which is mainly small island developing states, we don't have this seat at the table. So although there are things that we didn't like, there are also many things that have been huge steps forward. But there are still some issues that I think need to be addressed. And although this is a health forum, I'm going to go into this whole thing about economies and how economies are characterized. Because at the end of the day, all of us have to survive in this new world that COVID is creating. And because of the way COVID is so pervasive, we need to have a change in how our economies are looked at, how debt is looked at. Because if we don't, we will be forced into doing things that could lose lives. Now, the CARICOM region is very small. Our people are our greatest resource, and therefore CARPHA's advice has been extremely granular. We don't have millions of people that we can afford to let them die. And we also need to have people who can govern our world, this new world, because they have the experience and the training and the expertise. And so we have tried to find ways where we can preserve as much of that governance in the way forward. So I'm not sure how much time I have, but I think that COVID is forcing a kind of new world order that the world needed. It's unfortunate it has to go along with loss of life, but there was a rethinking of systems, the ways in which we approach climate change, the ways in which we look at our economic order. We need to look at these systems because COVID is forcing us to, but we needed to do that anyway. So there's a silver lining. The global response, I think, has improved tremendously. There was a lot of inequity, there was a lot of selfishness in what went on earlier on, but it's getting better. And I am hoping that this region of the Americas can show other regions some of the ways in which we can live together and be each other's, our brothers and sisters keepers. Thank you.
Gracias, Dr. Joy. Gracias por su intervención. Ahora, y gracias por el tiempo también.
Your intervention, and thank you for your time. We now will give the floor to Dr. Alejandro Solís, who is Executive Secretary of COMISCA. How was the response from Central America, Dr. Solís? Will we have this? We will have this last round and then a series of short questions, so that we can have at least a couple of rounds. I have to say that Dr. Juan Carlos Zevallos from the Ministry of Health from Ecuador will, sorry, we couldn't hear, so please keep to your 5-minute time.
Muchísimas gracias, Mauricio. Muy buenos días, muy buenas tardes.
Thank you, Mauricio. Good morning and good afternoon. For the Council of Ministries of Health of the Dominican Republic, it's an honor to take part of this Global Health Conference with the Americas, organized together with Florida International University. As you well know, at our Central American and Dominican Republican region, we are the SICA system, the integration system, which is the product of the Protocol of Tegucigalpa, signature in the 90s after the agreement due to the war conflicts that we had suffered. This has had an important development, and because of the pandemic situation, which we first had to face in March, we have a declaration of the heads of state and the government, and expressing that political leadership in a pragmatic manner, so that altogether as a region we could be able to face the pandemic. In this context, the heads of state were instructed us so that we would work on a contingency regional plan to complement the national efforts that were already underway in the region. And most importantly, for this contingency plan is, we need to say there are three pillars of work: the health, and risk
vinculado a comer
management pillar, the second
finanzas,
one
el
linked to
tercero
economy and
la
finances, and the
seguridad, la
third pillar
justicia
linked
y la
to
migración. Hay
security,
dos
justice,
ejes
and
americanos
migration. There
en
are
el
two
plan, que es el
transverse
eje de
axes on this plan,
comunicación
which are
de
the
riesgo
communication,
estratégico para
the risk
nosotros
communication
y la gestión de la cooperación
act, the
internacional.
strategic for us, and the
Con este
international
plan nosotros hemos
cooperation axis.
podido trabajar
With this
en una
plan, we have
serie de
been able to
acciones que nos han
work in a series
permitido
of actions which
optimizar de
have
forma
allowed us to
que
optimize the
regionalmente nosotros
efforts
veníamos
which
haciendo y
regionally we
que
were
ha
undertaking,
permitido
and
la
this has allowed
construcción de
us
una
to formulate
propuesta de
a
trabajo a nivel de
proposal
alianzas
to work in
intersectoriales para
alliances between
enfrentar los
sectors in
problemas de
order
la
to
economía
face
regional.
the economy
Al
problem
principio
in,
hubieron
as
algunas
a
medidas
region. Initially,
particulares
there
en los
were
Estados
some
miembros en
specific measures
donde
of some member
se
states
produjo
where
una dificultad en la libre
there was
movilidad
some
de la
difficulty in
carga
the
de mercancías en la región
ability to
y
move
eso
merchandisers
tenía la
throughout the
amenaza de
region, and
poder
that
ocasionar
was a
desabastecimiento de
potential
productos
threat for
fundamentales,
lack
la vida
of
de las personas.
supplies of fundamental products
Logramos
for
resolver
the people in the
con la
region. We were able
formulación
to
de unos
solve this
lineamientos de
with
bioseguridad ante la
formulation of
COVID
some
con
guidelines of
viajes a las zonas de
biosafety
transporte
that
terrestre
were
centroamericano.
applicable to
Y
the
igualmente hemos
ground
venido
transportation
trabajando
in
de la
Central
mano
America.
con el
We also
Parlamento
have been working
Centroamericano,
hand in hand
que es
with the Central
parte del
American
sistema de
Parliament, which is
integración,
part of the
precisamente
integrated
para
system,
buscar
to
consensos y
search for
alternativas y
consensus
propuestas de
and
políticas públicas
alternatives
que nos
and
permitan
proposals of public
allanar
policies that
el
could
camino
allow
sobre
us
algunos grandes
to
desafíos que la región ha visto
improve
de manera más
the
manifiesta
response to the
en este
challenges
contexto de
the
la
region
pandemia.
is facing in this
La región cuenta
context
con
of
un
pandemics. The
mecanismo de
region has
negociación de
a
precios para
mechanism of
renegociación y compra
price
conjunta de
containment for
medicamentos. Y
the
aquí es muy
negotiation
importante
and
decir que hemos
purchase
aplicado
of
este instrumento
uh,
para la compra de
medication
equipos de
as a
protección
whole. We've applied
personal
this to
para los
buy
Estados miembros y
PPE
que
for the
logró
member
en esta
states, and
negociación
we
por
were
economía de escala
able,
una
with this
reducción del
negotiation and a
61% con
scale up
respecto al
economy
precio de referencia que teníamos
improvement with
de
regards
mercado
to of
sobre estos
66%
equipos.
with regards
Quiere
to the
decir
reference
que
prices we had
si nosotros
with
nos
regards to the
unimos
PPE
y si
equipment. So that
trabajamos
if we
como
come
bloque,
together
podemos
and work as a
adelantarnos a
block,
resolver
we can
muchas situaciones
actually
que si
resolve
vamos de
many
manera particular, de
situations
forma
that if
aislada,
we
se
would
hacen
face
mucho más
in
complicadas.
isolation
Por otro
and
lado,
alone
hemos
would become more
aprovechado las
complicated.
facilidades de
Also, we
las
have
plataformas virtuales con la
used the
realización de
virtual
webinarios de
platforms to
capacitación
carry out
en línea,
webinars and training sessions
utilizando la
online,
plataforma de ECHO
also using the
para
ECHO
trabajar
platform
algunos
to
problemas de
work
salud más allá
with regard to
del
some
tema de la
health problems
COVID-19. Por supuesto que
that
la
went beyond the
COVID-19
COVID-19.
tuvo
Of
una
course, the
preponderancia
COVID-19
en estas
was
capacitaciones, pero no
prevalent
hemos
in
descuidado también
these
la
training
atención de
sessions, but
otros
we have
problemas de
also
salud
not
pública que
neglected the care
consideramos
of other
nosotros que no
healthcare
son
problems, which we
atendidos
believe
se
that
convierten en
if
un
they
pasivo
go
de morbimortalidad
uh,
que en los próximos
mm,
meses va a tener una repercusión
unattended, that
significativa
will
dentro de la
have a
región, como por
significant
ejemplo las
repercussion on the
non-transmisibles
region.
o
For
las
example,
infecciosas como la malaria, el dengue,
non-communicable diseases or
etcétera.
others such
Y
as
por otro
malaria
lado,
and
hemos
dengue.
aprovechado
Also,
también este
we have
contexto para
also
desarrollar
used this
precisamente una
context
campaña
to
educativa
develop
fuerte,
an
regional,
educational
intensiva,
campaign
que
in
nos
the region, an
permita
intensive
transmitir
campaign
mensajes de
that can
prevención y de
allow us to
promoción a la población,
convey
inclusive para poder
prevention
evitar
messages to the
las noticias
population and
falsas, los
to
rumores,
avoid fake
las
news
cosas
and
que
rumors,
confunden a la población para
news that
poderlas
might
aclarar y
confuse
que
the
puedan entonces
population,
enfrentar esta situación
clarify
con un
the
equilibrio
information
más
so that they can
balanceado
face
en
the
sus aspectos
situation with a
emocionales y
greater
psicoafectivos.
emotional
Nos parece que ha
balance.
sido
And
incidente este
we
esfuerzo que hemos
believe that
desarrollado
this
y por
effort that we
supuesto
have
también
developed has been
hemos
useful, and we also
logrado
have
que en la región
achieved
se tenga una
in the
perspectiva
region
diferente
a
en cuanto al
perspective that
abordaje
is
de los
different with
problemas de la
regards
salud
to
y la
how to
enfermedad,
approach the
partiendo no
problems of
solamente de los
health
factores
and
de
disease,
riesgo que explican
not
estos
only
procesos,
considering the
sino
risk
que también
factors,
busquemos las
that
causas
explain these
estructurales de
processes,
estos
but we also
problemas
have to
y que
look for
precisamente
the
podamos
structural
entonces
causes of these
identificar
problems so that we
estas
can
dificultades, estas
identify
limitaciones
the
y proponer
limiting
alternativas para
problems
una
and
transformación
propose
de los sistemas
alternatives
nacionales de
in
salud.
order
No
to
podemos seguir
transform the
trabajando
national
como
health care
antes de la
systems. We cannot
pandemia.
continue
Hemos
to work
aprendido
as we did
mucho.
before the pandemic. We have learned
Nosotros
a lot.
creemos que
We
dentro de las
believe
lecciones
that
que se ha aprendido en el
among the
mundo, en
lessons
sistemas de salud
learned
dominicanos
worldwide,
y
and we in
Latinoamérica
Central
debemos
America and the
resaltarlos.
Dominican Republic have
Me
to
parece a mí que
underscore
son
this.
de tres niveles.
I believe
Lecciones
these are
aprendidas desde
comprise
el
three
sistema
levels.
global,
Lessons learned
en
from the
donde debemos
global
nosotros
level, where
reconocer que el
we
mundo
have to
invisible, los
acknowledge that in
microorganismos,
the
nos van a
invisible
seguir
world of
acechando, van a
microorganisms,
seguir
they will
atacando y causando
continue to
problemas. Y
threaten
en
us, attacking
consecuencia,
us, and causing
tenemos que
problems.
escuchar a
Hence,
los
we
científicos
need to
que muchas
listen
veces
to the
nos alertan con
scientists that very
anticipación, pero que
often
nosotros no
will
les ponemos
alert
atención.
us
Y por otro lado,
with
apoyar
anticipation, but sometimes we don't
investigaciones
pay attention to
necesarias
them.
que
Also,
nos
we
den
need to
evidencia
support
para la
the
toma de
health,
decisiones y
the
generar
sanitary
los
research
cambios
so that we
genéticos
can
de estos virus,
survey
porque
the
más allá de
changes in
estudiarlos
these
en las
viruses,
personas, también no debemos
because we not
descuidar
only
en
have to study
estudiarlos a
them
nivel de
in
los
the
animales,
effects on
porque
persons,
en
but
los
also on the
animales
effect on
donde podemos
animals,
sufrir
because it is
otras
on animals
variaciones que
where
cuando
other
salgan a los
mutations can
seres
occur,
humanos,
and
entonces
when they
tenemos
jump
dificultades. Y
to
como estamos
the
hablando de
human
la
beings, we
vacuna, pues
have
la vacuna está
problems. And since
diseñada
we're
para
speaking of
una
the
situación
vaccine has been
concreta, pero
designed
no
for
para
a
que hayan
specific situation,
mutaciones sobre las
but
cuales
not
la vacuna
considering the
probablemente no va a tener mucha
mutations
eficacia.
that,
Y
of course, the
también
vaccine will
las
not have
lecciones
effect on.
aprendidas a nivel
Also, among the
de las
lessons learned,
instituciones
we have to
en
consider the
nuestros ministerios.
institutional aspect
Debe de
in our
haber
ministries. We
mayor
need to
valor a
have
la salud pública, a
assign
la
greater
medicina
value to
familiar y
public health,
comunitaria,
to
a la
family and community
epidemiología, a los
medicine, to
enfoques de prevención y
epidemiology,
de promoción,
to
educación.
research
No tenemos que
and
quedarnos
prevention and
anclados en ese
promotion. We don't
enfoque
have to
curativo,
stop
hospitalocéntrico,
thinking
que
of
muchas veces
cure,
reproducimos y que es lo que
and that
daña
approach that we
la
often
forma en que las
reproduce and
personas
damages
se
the way in
convierten
which
en
people
sujetos para la transformación de su propia salud.
become subjects in
Creo
order
yo
to
que el
be
otro
able to act
aspecto
on their
tiene que
own
ver con el tema
health.
individual,
The other aspect, I
familiar y
think, is
comunitario.
related to the
Hemos
individual, family,
aprendido
and community
también que
aspect. We have
profilaxis
learned
es
that
fundamental para
prophylaxis is
todos y
essential
que
for
debemos
all
de
of us,
controlar
and
el
we
pánico
must
y
be
precisamente
able to
llegar a ser más
control
comprensivos,
fear and
ser más
panic, and be
solidarios y
more
tener ayuda
understanding,
hacia otras
have greater
personas, ser
solidarity,
menos
and help other
materialistas
people, be
y
less
querer más al
materialistic,
personal
and
de salud,
we have to
respetar el trabajo del
consider
personal de salud que con
in
mucho
with
esfuerzo y
greater
con
respect
mucha
the healthcare personnel,
entrega
which with
física
great effort
incluso ha ofrendado
and
su vida por los
has
cuidados de las
even
personas
given
que
their
están
lives
padeciendo de la
while
enfermedad
caring
en
for
estos
people
últimos
that were
tiempos. Muchas
suffering the
gracias.
disease recently. Thank you for
Gracias,
your
doctor
attention.
Solís.
Thank you,
Importante
Dr.
recoger de
Solis.
su
It's
intervención
important to
la
mention
circunstancia de que la
in your
pandemia
intervention
es
the
una
circumstances
circunstancia que
that
se
the
va a
pandemic
poder
is
repetir en los
something that
próximos años
may be repeated in
y
years
al
to
mismo
come,
tiempo
and
algo que
also
ha
at the same time,
desnudado la
something that
realidad de la
has
pandemia
revealed the
es la
reality of
debilidad
the
de los
pandemic,
sistemas
and
de
that is
salud.
the weakness
Estamos en
of
el
the
momento
healthcare
adecuado
systems.
para
We are
fortalecer los
now
servicios de
in
salud.
adequate time
¿Cuál
to
es el valor
strengthen the
agregado que
healthcare
desde
services. What is
los
the
mecanismos
added
de
value that
integración
the
puede
integration
llevar
mechanisms
a fortalecer
may
los sistemas de salud?
actually contribute
Uno
to
pensaría
strengthen
que
healthcare systems?
los
One would
procesos de
think
integración
that
entre
the
los países,
integration
no solamente
processes
para la
amongst
libre
countries not
movilización
only
de
apply
bienes y
to just
servicios,
movement, free
sino es para la
mobilization
protección
and
de
movement
los
of goods
seres
and
humanos
services,
que
but
son
also
portadores de
for
derechos.
human beings
Y en
that
ese
move and that
sentido,
have
la
their
pregunta
rights.
central en
And
una
then in that
ronda
regard, the
rápida,
central question
¿estamos en el
in a
momento
rapid round would
adecuado?
be, at we
Quizás
are the right
nunca
time.
antes la
Maybe
salud iba a
never
estar en la
before
agenda de los
health
gobiernos.
was going to be in the
¿Estamos en el
agenda
momento
of the
adecuado
government. So
en
is
que
this
con
the right
liderazgo los
time
mecanismos de
where with
integración
adequate leadership,
puedan
the
plantear
integration
la
mechanisms may
transversalidad
actually
del derecho a la salud entre los
consider the
países? Por favor,
right
un
to
minuto para
health
cada
and
uno
its
de ustedes en este
application
sentido.
to different countries?
Doctora María del
1 minute
Carmen.
for each of you. Dr. María del Carmen, please.
Definitivamente estamos en el momento
Definitely, we
preciso.
are in
Estamos,
the
este es un
right
momento de
time.
crisis, pero
This
se puede
is a
volver en un
moment of
momento de
crisis, but
oportunidad.
this can
Y
become a
nunca
moment of
antes,
opportunity.
nunca
And
la
never
salud ha
before
tenido tanta importancia.
health has been
Y yo
so
creo que este es el
important.
momento
I do
en que
believe that this
debemos
is the moment
aceptar
in which we must try to use the networks of services and amongst the borders, and we have to strengthen the primary care as a hinge mechanisms and attention to the first level of care. And we also need to foster production nationally and regionally regarding devices and medicines. And we must not forget the human resources that needs to be better trained, and also with a more humane point of view. We need universal healthcare systems that are inclusive, resilient, and especially that can respond to the needs of the populations, because the populations differ in different countries. We have indigenous populations, we have marginalized populations, we have others with disabilities, others are in extreme poverty, and all are different. So also our systems need to be able to respond to the different populations and prioritize the social determinants aspect. How can I ask for a new normality if not all countries have running water to wash their hands
¿Quiere
with?
decir eso que estamos en el momento
Does
de
this
las
mean that we
políticas
are at
públicas
the moment
compartidas
of
entre los países
shared
en
public policy
lugar de
between
cerrar las
countries?
fronteras y
Instead of
encontrar
closing our
mecanismos
borders,
en
we need
medio
to
de la
find
crisis post
mechanisms in the midst
pandemia
of the
para
crisis
sumar
due to
porque
the
juntos
pandemic in
somos
order
más
to
que
add,
separados.
because
Y sin
together we are
embargo,
more than if we
existe
are
ese
apart.
desafío.
However, there is
¿Qué
that
opina la
challenge.
doctora Joy?
What does Dr. Joy.St.John think, doctor?
So I think it's a challenge, but sorry, let me get rid of this phone so that I don't hear myself. It's a challenge, but it's because of that a way that we can really shape this opportunity. I have to echo the previous speaker. It's a marvelous opportunity. And she put a tall order for the health services in terms of all of the things that she wants involved. But she did something that I totally agree with, which is having primary health care as a foundation for most of our interventions, because then we'll get the education and the prevention firmly cemented, and it's the cheaper way to deliver our health services. And it is not just the right to health, but it is access. Access. Right is one thing, but access is where the rubber hits the road. But I want to say one thing about the health professionals or healthcare workers. I don't think we've done a good job with looking at their mental health. And I think we need to strengthen our mental health services, not just for our general public, our patients, our clients, but also for our staff. This is the mother of all pandemics. It is a marathon being run at sprint speed, and people are just being expected to deliver. I want to put in a plug for strengthening mental health services for our staff, for having interventions which make them know how important they are. And then in terms of the borders and so on and so forth, remember I spoke about this testing before travel. We've got to speed up our services of lab testing and getting back good results. We need to have cheap, we need to have affordable PCR. We have not got antigen or antibody tests which allow for diagnostics. So we have to ramp up what is available, what is affordable, so that we can have safe travel. The protocols, if you look at the protocols for all the regions for safe travel, the social distancing, the masks, the hand washing, all of that is fine. We can get all of that across the world. Well, there are some countries that resist it, but those protocols are there. But the facilitation is to have access to testing so that we can have safe movement. We are seeing lots of spikes right now in countries because we haven't got that right. We have to find some way to get that right. Unfortunately, that's the way COVID is. And COVID doesn't care, so we've got to find a way to make humans care.
Gracias, doctora Joy. Acceso real a los servicios es lo que reclama la ciudadanía.
What the citizens are requiring, demanding. Central America is achieving this. What added value from the integration mechanisms and help for Central America can you describe, Dr. Alejandro
Muchas
Solís?
gracias.
Gracias.
En primer lugar,
Thank you
yo
very
creo que
much.
tenemos que
First of all,
reconocer que estamos en
I think
tiempos
that we
cruciales
must acknowledge
para
that we
llevar
are in a
adelante esos
crucial
cambios,
time so
pero
as to
tienen que
make
ser
these
cambios
changes. But
pragmáticos,
they must be
no
pragmatic
retóricos.
changes, not rhetorical
Realmente en
ones.
nuestra región
In our
nosotros
region,
consideramos que el derecho
we
a la salud
consider
es irrenunciable,
that
es
the right
innegociable
to
y en
health
consecuencia la
is non
política
negotiable.
pública tiene que
So,
tener
the public
correspondencia con
policies
ese
must
mandato que tenemos
correspond to
para
this
que el
mandate that
acceso
we have
universal,
of
la cobertura
access and
universal
right
sea una realidad.
to
Pero
health.
para esto requerimos
But for
voluntad
that,
política de
we
nuestras
need
autoridades y no
political will from
solamente de
our
los gobiernos,
authorities, and
sino que
not
estamos
only from the
hablando de la
governments,
voluntad
but we are
política
talking
del
about
Estado
the
como
political
la
will of
estructura
the
máxima
state
que contiene
as the
todos los
maximum
poderes que
structure
dan
that
la
has
vida y la
within
efectividad a
itself
las transformaciones
all the
sociales. Por
powers
otro lado,
that
las
give life to
autoridades
all the
nuestras
social
tienen
transformations. On the
visión
other hand, our
estratégica que
authorities
nos
have a
permita
strategic
colocarnos en
vision
perspectiva
that
hacia
will allow
adelante,
us
hacia el
to
futuro,
place us in
reconociendo que el
perspective in the
virus es un
future,
virus que va a ser
acknowledging that the
endémico y
virus
va a
is
ser
a virus and it's
estacional
going to
en
be
nuestra
endemic
región.
and it's going
Y
to
por
be a
otro
seasonal
lado,
one in our
sin
region.
descuidar lo que
And
he
on
dicho
the other hand,
anteriormente, el tema del financiamiento
and
es crucial.
without
No podemos
disregarding what
nosotros
I said before,
tener sistemas de salud que
financing
se quieran transformar
is
con
crucial.
una
Our health
inversión
systems
en
cannot
salud que tenga menos del
transform
6% del Producto
without
Interno
a
Bruto.
less
No es posible
6% of the
hacer
GDP
transformaciones
allocated
profundas para
to health
beneficio de la
resources. It is
población. Y
impossible
por otro
to
lado,
generate
nosotros
transformation,
creemos
true
que ese
transformations
recurso
without
tiene que ir
that amount of
dirigido
money.
hacia
This
aumentar las
resource
capacidades
must be
institucionales,
directed
como ya se
so
ha
as
dicho.
to
Por lo
increase the
tanto, nosotros
institutional
consideramos que
availability. That
hay
is why
las
we
condiciones en estos
consider
momentos
that we
para
do have the
hacer
conditions nowadays
transformaciones
so
verdaderas
as
y no
to
simplemente
achieve
aquellos
true
procesos de reforma
transformations
que se dieron en la
and not
década de los
only the
90,
simple
en donde
reform
lo que
processes
fue
that we had
simplemente
back in the
hacer ahí
90s
es
where
ajustes estructurales, compactación
we
del
only
Estado, reducción del
did
personal de
compactation of
salud,
the state, reduction
desaparición de
of
muchas
the
unidades
health
precisamente por falta de
personnel,
financiamiento, cambiar el
elimination of
rol del
many
Estado
units due to the
que
lack of
debería de asumir
final
esta
resources,
responsabilidad
and
y por lo
change the
tanto
role
ahora
of the
tenemos que dar
state that
un giro
must
de
be the one in
180 grados
charge of this,
para
must
poder
be the
garantizar
responsible for this.
que estas
So
políticas
now we
públicas
must change
realmente
gears
tengan un
in order to
impacto
guarantee that
en la
these
población y
public
que ellos puedan
policies have
sentir
an impact on the
verdaderamente
population,
que los
and that the
servicios de salud
population
son
really
accesibles,
feels
no hay
that the
barreras,
public
tienen
health
calidad
systems are
y que
accessible,
además les dan
are
un
of high
trato
quality,
humanizado,
have no
que al
barriers,
final es
and
lo que
treat
la
them like
gente
humans.
necesita,
That at the end of
sentirse
the way,
como
it's what
persona
the
cuando llega
people
a
need
visitar
to feel
una unidad de
as a
salud y no
person
como un
whenever they
paciente
come to a
más
hospital
que
or a
atender.
clinic, and not
Gracias,
be
doctor
an
Solís.
patient
Sí,
more.
la comisión de alto nivel de la
The
OPS en su
high-level
momento
commission of the
mencionó que no
PAHO
menos
back
del
then
6% del
mentioned
Producto
that
Interno Bruto. Sin
at
embargo, las
least you
brechas que ha
needed to
dejado la
allocate
pandemia y la
6% of the
desnudez
GDP.
que ha producido
However,
en los sistemas de
pandemic has
salud nos
shown
llevaría a
that
pensar
the health
que el
systems
porcentaje debería de ser mucho
receive
más y no
or
menos del
need to
30 al
receive more than that,
35%
and not
en
less
atención
than 30
primaria
or
y no más
35%, at
del
least for primary health
15%
care,
en
and
gasto de
not
bolsillo.
more than
Una última pregunta
15%
para
in pocket
despedirnos. Se
expense.
nos agotó
Last
el tiempo
question, just to
y
wrap up this
despidamos
session
este
because we've
panel con
run out
visión
of
de futuro.
time.
Para el 2021 se
For
viene un
2021,
desafío
we
importantísimo
have
con
a
relación
new
al
challenge and a very
acceso
important
real a la
one with
vacuna.
regards
Juan,
real
en dos
access to
palabras,
vaccination. In two
despidamos
words,
cada
please.
uno el panel mencionando
Define Exactly. From the integration mechanism that you represent, what is the initiative and what is the added value that you can bring to each country so that from the integration progress there is a better access and an equal access to vaccination? María del Carmen.
En este momento se está llevando a cabo el
Currently,
webinar acerca de
we
calidad,
are
acceso y equidad en
holding
vacunación.
the
Es el
webinar on
webinar que hacen
quality
ORAS
access
ONU
and
y nosotros hemos comenzado
equity in
a trabajar
vaccines,
muy
and
fuerte
we have
con
been
los
working with COVAX
directores de
there, with
inmunizaciones
the
de nuestros
directors of
6 países.
immunizations in our 6
Estamos,
countries.
digamos, colaborando, haciendo lo que le
We are
toca
collaborating,
a nuestra
working hand in hand
organización,
with
es
them,
a través de la integración
and
regional contribuir a
through
la
the
salud y el
regional
bienestar.
integration,
El
we want
tema
to
de
contribute
vacunas
to
va a ser un
well-being and
tema
health.
muy importante. Yo creo que
Vaccines and
va a ser
immunizations.
muy,
This is
muy
going to
importante
be
porque
a
todavía no
very
tenemos
important
muchas cosas
topic.
claras. No tenemos ninguna aprobada, no
We
sabemos
do
cómo va a
not
ser
have
la
a
caída del frío,
single
no
vaccine
sabemos
that
cuál va
has
a ser
been
la vía,
approved.
no
We do not
sabemos
know
cuántas vacunas va a
about
ser y
other
realmente hay muchos
cold
mecanismos,
chain, how
todos
many
están en
doses, and
COVAX,
there are
también
many
hay
mechanisms. They are
reuniones
all in
bilaterales con
COVAX.
laboratorios,
They are
pero
holding
efectivamente lo que
bilateral
necesitamos
meetings
es
with the pharma industry,
acceso
but we do
oportuno,
need
calidad, ¿no?
opportunistic access,
Calidad,
quality,
seguridad y que
safety,
llegue a todos los que
and
debe
that
llegar,
the vaccine
¿no?
gets to
Quizás en
all the
varias
ones that
fases,
need
pero
the vaccine.
definitivamente
In
estamos
several
apostando a eso.
phases,
Muchas
yes, but
gracias.
we are aiming at that. Dr. Joy, concrete integration actions. In half a minute, please, because we're running out of time.
We are working hand in hand with PAHO in terms of the vaccines. So PAHO will support the countries in the connection to the COVAX facility. And what CARPHA is doing, because we've got a pot of money from the European Union, CARPHA is helping with the down payments for the COVAX facility for the countries that have done all of their administrative sign up and so on. So we're working on that. The other thing that we have been looking at is this whole issue of what would be supported as the way in which to decide who gets the vaccine. And we've been using this formula from the start in terms of procurement of PPE, et cetera, and we base it on the NCD burden. We base it on the risk factors for NCDs. We base it on the age profile because older people are more at risk. And we also base it on what other supports they have for getting things on their own. So we're going to be working with PAHO and the member states on refining that formula that we used for the other things for the vaccines so that there is some kind of equity and a regional approach to how the distribution goes forward. And then we want to support on this whole issue of the fake news that has been going through about the vaccine, which has started to cause vaccine hesitancy. So we will work with PAHO in the support on those messages.
Gracias, doctor Joy. Unas últimas palabras, doctor Alejandro Solís. Despida usted
Solís,
el panel con
just
una
to wrap
visión de
up, and please
futuro
close
en
the
Centroamérica.
panel with
¿Qué va a
a
suceder desde el
future
organismo
vision
que
for
usted
Central America. What is
dirige
going to happen
pro la
from the
vacunación de la población
organism that you are
centroamericana?
in charge of with
Muchas
the
gracias. Tres
vaccination
cosas
in Central
concretas.
America?
Uno, estamos haciendo un
Three very
planteamiento
specific
a
topics.
través de
We
la
are
Secretaría General del SICA para que
working with
nuestros
the
presidentes
SICA
se reúnan y
so that
tomen la
our presidents
decisión de
get
hacer una
together
negociación de bloque.
and
No vamos a
make a
entrar a hacer una
decision
negociación
as a
particular. Eso no es
joint
bueno, no va a
area.
ayudarnos
It's
a
not on
nada.
a particular
Tenemos que
basis,
negociar en
not country
bloque.
per
Y si se
country.
puede
We
hacer
must
con
get
el bloque
united and
mesoamericano, sería
negotiate
fantástico.
For
pero el
example, as
sistema de
the
integración debe
Mesoamerican
buscar
region,
negociar en bloque.
for
Dos,
the
tiene que haber una
integration, we
reunión
need to work
extraordinaria de
together.
los
Then there must be an
presidentes y del Consejo de
extraordinary
Ministros
meeting
para tomar las
with the
decisiones
presidents
que
and
puedan
the
impulsarnos a nosotros hacia
advisory
acciones
board of
concretas
the
para
ministers
que
so that we can
consideremos
put
no
forward concrete
solamente una
actions, so that
opción
we
de la
consider not
vacuna,
only
hay
one option
distintas
for
opciones a nivel
vaccinations.
mundial
We
y
have
hay que
different
colocarlas sobre la
options on a
mesa
worldwide
porque de
level,
todas hay
and
que
we must
aprovechar
analyze
lo
each and
mejor
every one
para
of
poder
them
servirle a
so
nuestra
that
población
we
esa
can
vacuna
get
en el
or
momento
give our
oportuno para que
population
nadie se
when they
quede
need
atrás
the
y todo el mundo
vaccine so that
goce de la
everybody
prevención que es
gets
tan esperada por este
vaccination
instrumento tan maravilloso
and
científico en el
can
que nos tiene
benefit
que dar
from
un
this
cambio en la
prevention.
nueva normalidad. Muchas gracias.
Muchas gracias. Gracias a todos
Thank
ustedes
you
por su
very much
participación.
for
Estamos
being part
culminando
of
el
this
panel.
panel.
Tendremos
We
un
are
break
now
de
wrapping
30
up the
minutos.
session. We are
Muchísimas
going
gracias
to
por su
have a break
atención.
of 30 minutes and we will reconvene in half an hour. Thank you very much.